A very good morning, everyone. Welcome to Divyansh Friday at DivyanshRehab. Our purpose of this chat is today to share awareness of Doctor of Audiology (AUD), and we primarily want to focus on the eligibility criteria, prospect, duration, potential of the candidates or aspirants looking for this course. For this particular course, which is there abroad, we have a special guest today, Dr. Anirban Dasgupta, sir. He's working as Dean, very welcome, sir. He's working as Dean MAPS Group of Institutions, Mangalore presently. Sir has an immense experience in the field of patient hearing. He also is into mentoring of professionals. Sir has an experience of teaching since last 28 years of his career. He has worked with different industries as industrial audiologist and offered consultation for hearing conservation. He is among the few, very few of his time, who has actually done Doctor of Audiology from Salus University. He has always been a visionary and he could purview and see things way ahead of his time. He was always ahead of his time. And he has his expertise and capabilities. There are numerous publications, presentations, and awards, nationally and internationally. His special focus is in the area of developing and sharing knowledge related to hearing care, newborn hearing training, and auditory rehabilitation. Sir is actively engaged in teaching, research, delivering. He has more than 1,000 students he has mentored and has successfully settled as working professional. He has also worked in Australia, Singapore, and focused on older adults and adult life. Sir has run PRE and CME and medical fraternity conferences to his credit. He has presented over many research papers over 30 countries all over the world in the field of audiology and voice. He is the first voice coach of India. He has also received several state universities, awards, and recognitions in the field of music, hearing sciences, and rehabilitation. He also owns an MBA degree. He has been specially honored by governments of India, United States of America, and a very passionate human being. Very welcome, sir. We are more than honored.
Thank you, Arpita and DivyanshRehab Academy for including me in these sessions. It's a privilege and really it's a good thing to speak about the advancements in the field of audiology.
Yes.
Please.
So you have done Doctor of Audiology back in 2006 when people were not even aware of what to do beyond bachelor's. You were very ahead of your time. So I would therefore like to request you to kindly tell something in an overview about what is Doctor of Audiology.
Okay, the Doctor of Audiology itself defines that it is a doctor. So
Yes.
it's not doctorate, it is a doctor. There is a difference between doctorate and doctor.
Yes.
Usually doctorate are the philosophy of doctorate, that is PhD, that is a research work. So you are much more focused on a particular subject, on a particular topic, and you are carrying forward that research. And that can be useful basically in the institutional setup or maybe in the research lab. But what happened overall, if we look into India or over globally, if we look into the audiology field, what happened? The audiology field is basically a clinical field. So you use your knowledge of audiology, basically you applied it on your patients in the clinic. You may be doing a research, but that research is again, as I said, it's a focused on a particular topic. But here, when you consider the audiology is very vast, very, very vast field. You see, like we come out of the institutions where we learn, we teach, and that's known as educational audiology. When we come to the clinic, we go into clinical audiology. We go into diagnostic audiology, where we really need to diagnose the case. So it helps the ENT surgeons or neurologists or pediatrics or psychiatrists, psychologists, many other people like to take forward the case for the treatment, for rehabilitation. Then we also participate actively into rehabilitations of the case, doing that hearing aid prescriptions, working with cochlear implants. So such there we work as in rehabilitative audiology. Again, when we come to cochlear implant, we work also in the operation theater for intraoperating monitoring along with the surgeon. So there we work on implantology. Then when we go beyond the ear, we enter into the brain, because what happens usually, we hear through brain, we only receive the sound through ear. Okay, though the receiving sounds through ear is not the primary function of the ear, the primary function of the ear is balancing. Secondary function is hearing, and the third function is temperature maintenance. So we hear, that's why where we receive, then we put it in the inner ear, and then through inner ear we put it in the brain to understand what we are hearing. So what we do is, first we go for detection, then we go for discrimination, then we go for identification, and then we go for comprehension. This is our step of hearing. So when we comprehend what we hear, so that remains with the brain. So when we enter over there in that area, completely into that area, there also we play a big role. So we work with the different type of processing disorders with the patient. Even in the balance part, we also give a hand as a balance specialist, that is vestibulometry. Other than that, what we do is, like, suppose, like, in case you work in the noise industry, we call it recreational audiology, or you may be looking for something like which is an old thing, but you want to reinvent, we work for forensic audiology. So like this, if you see, even if you compare the patients, like there can be pediatric audiologists separately, there can be geriatric audiologists separately. Then when we also go, like, as we go on the different manufacturing things, like for audiometer or for the hearing aids, there we works also in the R&D division, research and development. And things has progressed and progressed in such a way, what should I say, Arpita, things has gone even to the universe. Now we work with the astronauts. What we work with the astronauts, we work on the astronauts about their vestibular part or the balancing. What's happening when they're on the zero gravity, and what's happening when they are within the gravity. So the audiology line, I mean, it is really, really flourished like anything. We are beyond of many, many things. And we are with the surgeons, I will just mention to you in one thing over here. Some of the countries, even continent, we can say the audiologist, one of the highest profession. Even it is above the ENTs, above the neurology. Okay, it is equivalent to a surgeon, in the medical profession. Though in India, we are still known as paramedical or allied health. Now, coming back to my topic, that is for what is doctor of audiology. Doctor of audiology comprise of all these things. That is what you do clinically and what you can do more. Okay, so when you are going to an industry also for a screening or to do a rehab over there, like you are talking to them about protection device and all these things. If you have a doctor of audiology, what happens? Your thinking is very open. Your knowledge becomes much more precise because you know the testing which you are doing, you know behind it what it is there. For example, like as I was mentioning to you about the brain, that is, I forgot to mention there that we called it electrophysiology. So when we work with the electrophysiology, we need to know the anatomy and physiology involved in that. So in the AuD, you are taught in details by taking a specific test, like even for newborn hearing screening, as you just mentioned, which is there in worldwide now through United Nations, and it has been recommended by Joint Committee of Infant Hearing. So you see there that the recent versions 2019 says that we should start on the 0 days as soon as the baby is born. And we must complete our early assessment, that is, I mean, like whatever you are doing by 3 months time, and the intervention should start from 3 months. So that means what, usually what happens is, like when a child is developing, the child start talking and all these things. Basically the first step is definitely first birth cry, and then like making different sounds, but the speech or language starts with babbling. Babbling happens between 3 months to 6 months. That is baba, baba, dada, dada. I mean, combination of CV, usually one or two CV combination they do before they go to the first word. So if we can really put a proper hearing aid fitting over there to a child, and if the child is having hearing impairment exclusively for the high risk babies, the high risk babies, it is very difficult for us to do the things because some of them might be having involvement of seizures, epilepsy, and the things might electrophysiologically change within their brain. So, and we know that as per Dr. Anu Sharma's research in the field of audiology, we know that the brain plasticity is up to the time of 7 to 8 years. There are numerous studies to prove it. So we know that our time is very limited for giving a auditory learning, to giving a speech reading, as well as to do a overall auditory rehabilitation. So what happens? America started thinking on it. Since 1996, they started thinking on it. Slowly, they bifurcate it from a PhD to a clinical doctor. So what they say, when you are in a clinical doctor, in the course of AuD, you have been taught each and every segment in very much details. For example, if you're taking as like otoacoustic emissions, which we do like to a newborn baby, just 2 minutes, 3 minutes testing, we know what is the anatomy and physiology behind it, why we are doing it, what it is helping us. Is it only contributing for a neonatals? No, it also helps us for many other things, to detect many other things, okay, like in the adult also, as well as in the geriatric also. And it tells us about the future of the child, that whether the child is having, how is the inner structure of the child, whether the child is going to be prone for really for a hearing loss, or is the child can recover from the hearing loss. So all such things you will be told in details, and then about the instrumentation, then about the test. Similarly, like brainstem evoke response audiometry, if you're going for BERA, so ABR. So in details again on ABR, what are the things involved in ABR, what are not involved. Even the ABR, we know that it is a test only for eighth cranial nerve, that is the hearing nerve, vestibulocochlear nerve, but it's we call it auditory nerve. Not only that, it goes beyond. It goes to cerebellum, it goes to pons, and we know that we have several tests today like P300, MLR, LLR, so many. So, all these things you have been taught from the scratch till the up in the AuD program. If you're doing a PhD program, then only you focus on one particular test. There you may be focusing only on cerebellum. You're not focusing on other things. But here you are focusing. So in audiology, being an audiologist, when we are coming out after bachelor's, look, I have done it after master's, because when I was doing it, that time the criteria was master's plus 1 year experience. I have done it after 4 years of my master's. I was actually planning for PhD that time. I was supposed to go to do a PhD using, one of the parameters of impedance audiometer, that is gradient, and that too with the Northwestern universities under Dr.
Sir, are you there? Sir, are you there?
Any problem was there?
Yeah, in between. No issues are let it go. Kindly
Okay,
continue.
you can edit it. Okay, fine. So what happened is I asked him that why. He told that, Anirban, there are many people, those who have completed PhD are going now for AUD, because in future in US, this will be the basic criteria to enter into the clinical practice, even in the university. If you want to work in the university lab, not into academic teaching, then you need to be an AUD. So in USA, today it is a mandatory qualification that you need to be an AUD to work, because you need to work together in hand, hand to hand with a physician. So you yourself is a physician. So you can do cerumen management, You can do basic things which you are, see, surgery is not a plate of cake for us, and we don't do also, we don't involve also. But other than that, to work completely on balancing, to work completely on hearing, to completely working on the other things, we really do it being a doctor of audiology, like what the patient expect from you. Patients comes to you with their problem. Okay, so that is what we do with the AuD. Now, what are the things we cover in the AuD, if you ask me? So all the aspects of audiology we cover in the AuD, including Peyton audiometry, in that again special test, in that even we work with separately with tinnitus. So what is the tinnitus? Where the noise is getting generated? How does the tinnitus generation differs your treatment? Whether it is an endocochlear potential generations or whether it is really outer hair cells, that is cochlear microphonic generation. So everything you find it out and you do it in a different way. Now, why I thought about the AOD program is this program I was new very much when I discussed it. I discussed with Northwestern, I discussed with Florida University. Everybody told that what you will do by doing this course because it's not recognized in India. I never thought of that whether it is recognized in India or not. For me, getting the knowledge was an important. And what was happening to me is I was forgetting many of the audiology part because what happened, we work in the clinic in the audiology. We may be like, for very few hours, we work in electrophysiology, very few hours, maybe in balance, very few hours in pure tone. We become, like master. I mean, what you say is Jack in all trades, master of none. So you have to learn so many things and you cannot then compete the things. You cannot get competence in what you are doing because we don't get time to read about it, to learn more about it, because who will be teaching us? There is no one. If you go to that institute, the people says that you already qualified, you know the things. So there was a scope for learning, even cochlear implant, differently, like knowing differently, mapping, what details happened in mapping, what details happened in ABT. So everything. And like people do cochlear implant, but why cochlear implant many of the time is not successful? The audiologist also know it's not that always surgeon because it's not depends on the structure of the cochlea. It depends on many factors. So that even the audiologists know, but many of the time the audiologists hesitate to open their mouth by saying that no. Even if I tell you, like you will be quite surprised. I know that you know this part very well, but if I tell you by doing an impedance, okay, and just to look with the otoscope, and by doing an impedance we can really diagnose that there is a otosclerosis present in the patient. Okay, the doctor may argue. So when they argue, their otoscope is different than our otoscope. What you suggest them, you should suggest them, please use your cecal speculum and just see what happens there, the pneumatic otoscope, or you just go to the OT and open that things. And I have done it in my life, and I have found that the doctor comes back and tells, does really impedance says? I says, yes, there's an impedance signature. It is a signature. It's science that there is a otosclerosis present. So when you want to say all these things and you need to be at a level, at a par with the ENT surgeons and all, you need to have certain qualifications to say it. So if you go over there to say as a PhD, then the problem is like they may not accept you. But if you say, yeah, because they may feel it is a research. You have done the research, okay, your research is focused over there. But when you say you are doctor of audiology, then it differs. So what happened is like after completing of doctor of audiology, like I have added many feathers on my cap to work as a consultant, where the ENT used to charge 1,000 or 1,200 consultation fees. Even for me, that consultation fees is also the same. So so you can charge that, yes, I can give you a concern about it. Okay, the audiologist is doing the testing report is coming, then in and out what should be. And you have a right to choose over there what are the tests you will recommend. The doctor will not say anything over there because you say them clearly, you are an MD doctor in your field. We are also audiology doctor in our field. We are not doctorate. Okay, so that difference comes over there. And when you do the testing and you show them that results that yes, really this testing was necessary, they don't argue. Otherwise, they will say, who told you to do beyond PTA or impedance. We have never asked you. So such decision it helps, and it started changing the scenario. So now today in see, I'm not the first Indian who has done AUD. Before me, my own batchmate has done, lives in AUD. Okay, also he has practiced with me in Kolkata for a long, long time. Then also many of my three of my seniors have done AUD, but they all left in USA. They never thought to come back to their own country. But then when I come back to India, and then I thought, okay, fine, the only thing is what I will say, the AUD assignments, they need a very good lab. If you think that you will do the AUD completely online by living in India and submitting some assignment, it is not possible because the quality of equipments, what you need to use is very expensive. And you really have to work with the patients to complete the assignments. So the courses are like you can take 2 or 3 courses at a time. Like, okay, I want to work on ABR, fine. I want to work on business in the sense after completing audiology, I will establish a clinic. How I will go for the clinic? What are the strategies I should have? The different laws, different reimbursement, then define whatever it is, the total things like you want to know. Then you want to also to at the same time you may be working with tinnitus. So you take these 3 courses. So these 3 courses for 6 months when you are taking, you will have every week to submit one of the assignments. So when I mean, yeah. So when you do this, the doctor will usually say that, okay, we have asked you to do pure tone and impedance, why you have done that, but you prove yourself that you have done that things. Okay. So what I was telling you is many people have done it before me. They have not come back. I thought to come back. And along with me, Dr. Kallani Manki, one of the legends in our India, like who is also PhD, she has also done AUD after PhD. So she also comes back in India. Then slowly our juniors, I was so thrilled to see that one of your classmates, who was seems to be my student in bachelor's, was my classmate for AUD. I was so thrilled to see him in USA when we were together and doing the classes together. And moreover, like he has not come back, he remained there only. But many of our students have gone, had come back, many of the other people. And today we have a lot of AUDs in India. We have more than 12, more than a dozen AUDs in India today working in different sectors. Slowly, what happening is Canada is also moving from masters towards the AUD. They also require AUD because there used to be 53 universities in USA who was doing AUD and 3 of them online. Now online mode is switching off and slowly going towards the offline mode. And because you have to do an externship there, otherwise you will not get the ASHA certification, CCCA. And yeah, and then what happens is like many people, so they have bifurcated the course now. They they kept a master's program which is also clinical audiology. So you come for the master's program there, or you start doing it online, and then you find interest, you continue it in the doctorate program. So the program for AUD is now definitely 4 years course, and it has started accepting students, but it involves masters and doctor, both together. It is no more separate. People can do it like during our time, we spent from our pocket, which costed me nearly 38,000 US dollar. If I could have like, it is complete thing because you going there, coming there, expenses, your staying expenses, your study expenses, you are paying in dollars. But it can be reduced also if you get stipend and all those things. We have never looked for it, but nowadays people get it. And Canada is coming forward. Philippines, which used to be a short country, used to have only audiology course after the ENT completion. Their audiology students are ENT basically. So they are also started looking for it. Even Gulf countries are also started thinking of like recruiting only AUDs to do. So now what happens, because now in India is producing bulk of PhDs, and also America 53 and Canada 4 5 colleges, and UK is no more still there. Australia is still waiting, but they may start anytime. So that's why what happened is that's why now the minimum criteria to enter into audiology practice into clinical field is becoming AOD. So it is important to have a doctor of audiology when you are entering into clinical practice. Still in India, a diploma holder, that is DHLS or a B.Ed Special Educations or a BSLP or a MSc Audio or MSLP or a PhD, when they land into market, they have to use their skill, not much knowledge, but they have to use their skill, how to sustainability in the market. But one day, slowly days are changing. People are looking for quality. So keep in mind, the days are not far. It is coming closer that one day people will look for quality. People will really start recognizing university graduated people. So that is, bachelors in audiology. They will know that what is the capabilities of a diploma. I'm not degrading any diploma students. They are also sometimes much better than bachelor students. But still, you need certain things. So licensing is coming into a picture in a bigger way. Awareness has come among the people now in a bigger way after WHO's and all those people's intervention. So AuD will be maybe one of the qualifications. It may not be recognized in India so soon, but yes, people planning to go abroad, settling down, working. If you have AuD, you don't have to think of like other countries to get licensing because it is easy. You will be accepted very easily for licensing to other countries. That's what the message I want to give to the new generations. And new generations is thinking, new generation is making the use of AuD and settling down in USA. I will say don't settle down, come back to India. So make India also richer with the qualifications so people, can really give a weightage to the university starting course, that is BSLP. So really, thank you very much for giving me an opportunity, DivyanshRehab Academy, and this is really nice to speak about it to the people. Whatever I can, I have shared with you. Now, lot of information is available in the internet. People do browsing. You can browse the universities and you can see the things and also the admission criteria.
Right. It's such refreshing and you have covered almost everything, sir. But few specific things I want to put it down as a take-home message. Uh, is it mandatory to do AUD if you're working in America?
Yeah,
That the
it is
case?
mandatory. It
Right.
is absolutely mandatory, not now. It has started since last almost 6 years, 7 years. It is a mandatory qualification. You cannot work with masters. If you go with masters, being audio also, you have to work in the speech therapy, but not in the audiology, not even in the hearing aid industry. If you want to work being a master in the hearing aid industry, then they have a course known as hearing instrument specialist or hearing instrument, this thing coordinators. They have a course which comes again under not under ASHA. It is again under a hearing aid association. You have to have a licensing, dispensing licensing from them, dispensing audiology.
Right.
And you have to do that course. That is again a 2 years course. Otherwise, you cannot do the dispensing. Yes.
So as you mentioned that it has been coupled together now. So your master's and PhD and your doctorate of audiology is coupled together for
Doctor
four.
of Audiology,
Right,
not
sir.
doctorate. Doctorate is PhD.
Yes, sir. Doctor of audiology and master's is coupled together, if I can
Yeah,
understand. So
yeah.
the entry level is bachelor's or master's for students who are going from India.
Entry level is bachelor's with 3 to 4 years of experience, or even some universities are accepting with 2 years of experience, provided I think they have to clear the GRE, TOEFL, and all these things.
That again is the criteria, right, sir?
Yeah, that is again a criteria. IELTS, of course, is a criteria everywhere.
Right, sir. So, if students do want to see which institutions do recommend or do facility of doctorate of audiology.
I will suggest that people should go in such an institute where getting the externship is very easy. So, like I have done from, it used to be like Pennsylvania College before Dr. George Osborne College of this thing audiology, and it is under Salas University now. And then like you can go to University of Florida, University of Manchester. Definitely Iowa is one of the universities. Texas, University of Texas. There are a lot of places, but then you have to look for like where it is easy. If you go for like the easiest, another easiest one is just to tell you the university which is made only for hearing impaired people by taking the hearing impaired people. Gallaudet University,
Right.
Washington. They also have AuD program. They used to have AuD program only for hearing impaired audiologists, but now they are accepting also normal. Most of the things used to be with American Sign Language there, but now it is changed. Scenario is changed. Their externship program will be little difficult, but other than that, like doing the externship programs, you need externship to do over there to get the CCCP. That is 1 year you have to go and you have to work there. That is same like internship here. And externship you can do with anyone like sonova.com. Even you can work with Amplifone, you can work with anywhere, but there should be an AuD from the ASHA. I mean, ASHA approved CCCA person should be there. If you say that I'll do it in India, I'll do it in Gulf countries, no, it is not accepted. It is not accepted even if you work in Singapore. Previously, it used to be accepted. Like we have some CCCA people in India where you can go and work in Bangalore and all. 1 year, you need a special permission and it is accepted. And you write a CCCA exams, you get the license to practice. But now praxis you can write from India, but you have to have an externship over there. Otherwise, you after you join any job, you have to do the externship there again. So it's like that. It's a mandatory thing. They need to know that you know rules and regulation of American.
Right,
No?
sir. So true.
Yeah.
And so the total duration of course is 4 years with externship or
4 years, yeah, 4 years now. But then if you have masters and you have done 3-4 years things, so then you need to take only 18 to 19 modules, which you can finish by, say each module is 6 months, you can take 2 modules there. So nine if you add, so how many months is coming? 2 years, 2.5 years, you can finish.
It's a very important information you have shared, sir. So
Yeah,
it's self-paced, I understand. It is a self-paced
yeah,
course where you can
yeah,
finish it at your own pacing, right?
pacing,
Okay.
yeah.
So, and for aspirant of dreaming, what is the cost? I know it is very difficult to tell right now, but if you can
Depends on like each modules will be costing you $600 to $700. So it depends on the course fee, because you will be like, we were lucky to be taught by very cream of the professors, Jasterbov, Hall, RB Dhillon. So these are all, yeah, these are all the very cream of the people who had taught us. David came, but Frank Musak. But now different institute had different peoples to be taught. So earlier time when only 5 university has this course, that time we really enjoyed. Now many places it's different thing. No.
So that's what, from your conversation, I can understand why only Googling does not answer all your questions. You need experts like Sir to answer questions just with a finger snap, which you will take years and years to understand. So we are so thankful to you, sir. You have shared it as much as
I
possible
also
in the
should be
limited
thankful
time.
to you for calling me for this. Yeah,
So we will look forward for more and more information from you in the future.
sure. I will try.
Thank you
Definitely.
so
We
much
will
sir, for
share.
being our guest
Thank
today.
you.
If you find this information interesting and want to know more about it, you can visit our website www.DivyanshRehab.com. We'll be soon updating our blog on the same topic for your ready reference. And please like and comment and share our YouTube channel if you like it and you feel that the information was worth. Thank you so much, ladies and gentlemen. Thank you so much, sir.
Thank you. Welcome.